So long story short, with SDOH, there's not really a hard left and right limit, right? So when you look at this
Yeah.
data, what does this actually mean, right? So you kind of need big picture, you need analytics, you need to be able to visualize this data to understand what that means. And so the vital conditions gave us a perspective, a lens, a framework to look at that data, interpret it, and give us actionable things that we can do to help improve, SDOH within our community. But yeah, so the other ways that for the ones that are integrating, right? You see a lot of HL7. You see a lot of API work with integrations, and API is kind of the go-to right now. So it's understanding the big picture. And, when we talk about kind of going back to the previous point, when we talk about people, owning their records, right? The big thing is people need to feel like their health records are their own and available to them in any manner, whether paper, digital, etc.
Welcome to Digital Health Transformers, a podcast series. In this podcast, we'll explore the dynamic world of healthcare innovation, one conversation at a time. I'm your host, Bryce Barger, and today we have an all-inspiring guest at the forefront of transforming the healthcare landscape. In today's episode, we are thrilled to welcome our guest, Aaron DeMontmourcy, Director of IT, Security, and Compliance at Elevate Health. His expertise lies in the critical intersection of IT security and healthcare, which is so important to us all. With almost 20 years of experience, he brings a wealth of knowledge as an accomplished IT security professional and a decorated veteran. Aaron's been dedicated to safeguarding information assets and infrastructure. His forte is strategically developing and executing comprehensive information security and IT risk management programs. Starting as a network switching systems operator in the U.S. Army, he continued his passion throughout. He continued his passion for info security throughout his career. Aaron's cross-industry experience provides a unique perspective on fortifying digital healthcare, from performing cyber attacks and defenses as information security analyst at the U.S. Army to heading IT, Sec, and compliance at Elevated Health. Join us today as we dive into Aaron's journey, his perspective on how digital health can help address social determinants. Thank you for joining us today, Aaron. How are you?
I'm great. Thank you for asking. And you guys are doing great things in the healthcare space. And so thrilled to be here. Thanks for having me on.
Yeah, we definitely really appreciate it. Kind of just getting started into your personal and your professional story. Your journey from the U.S. Army to healthcare is definitely remarkable, and something that you might not see every day. I'm sure it's probably more common than a lot of us know, but definitely a remarkable journey. What influenced you to switch from kind of that government, that U.S. Army role to kind of healthcare?
So, yeah, it's kind of a rather lengthy story. I'll try to boil it down. But essentially, I kind of just fell into healthcare, believe it or not. So kind of the story is, I did 6 years active duty. I went to Iraq twice. I got blown up one too many times, and yes,
Wow.
just one too many times. And I was like, you know what? I have a family, I have kids. I want to see grow up, graduate, do great things. So yeah, I'm just gonna get out of active duty for a bit. Maybe wait this thing out. Flashback, it was a 20-year war. Ain't nobody waiting that out.
Yeah, no way.
Yeah, no, not at all. So I went into the reserves for another 6 years. Just kind of waiting that out. Completely switched roles. I went from IT to watercraft engineering, which there's not much similarity between the two, but it is what it is. I thought it was fun. So yeah, during that time, I found it challenging to get a role in the civilian sector. I had a lot of experience, but I didn't have a piece of paper saying I kind of knew what I was doing. So I kind of just, so I kind of doubled back and just went to school, right? I did that full time for 4 years, got my bachelor's degree. And I've noticed a lot of veterans struggling with the same exact thing. So anyway, while I was going to school, and an opportunity came up to work for the late Paul Allen on his estate on Mercer Island, taking care of all of technology.
Wow.
That was an incredible role, and I was very thankful to have that. But ultimately, it wasn't the best fit for me for a number of reasons. So I ended up with another healthcare organization, kind of dual rolling as both kind of a security manager and an engineer, right?
Yeah.
And during that time is when I got into InfraGard, which is a public-private partnership between the FBI and the private sector, still ongoing today. Highly recommend anybody in the security space, getting into InfraGard as a member. A lot of valuable information there. But during that time frame, they were standing up kind of a healthcare component to it, right? And I was already in a healthcare industry. And what it kind of ended up being was more or less a glorified listserv for people in the healthcare space, revolving around cybersecurity. So I got pulled in with a team of like 20 or 30 other people to kind of vet this infrastructure that they had built. Ultimately, this kind of turned into HSCC, or the health sector. Oh geez, what is that acronym? I think it's health. Let me look that up, because I want to make sure that I'm speaking correctly. Okay. Ultimately, that turned into the Health Sector Coordination Council Cybersecurity Working Group. So that's kind of how that spun off, and it's been great watching that flourish as well. But yeah, went to an MSP, supported 40 clients. Again, we had a bunch of healthcare clients. They had cybersecurity and compliance needs. And I left that organization roundabout when COVID hit. It was devastating to a lot of businesses. Right?
Yeah, it definitely was.
And so I ended up coming to Elevate Health based off of someone I had previously worked with at that first healthcare organization that I mentioned. He said, "Hey, we need a director. We need this role. Do you want to come? You want to come work with me?" And I'm like, "Yeah, sure." Applied, and here I am, right? And in about 2.5 years, I've completely reorged IT, security, and compliance for the organization.
It's very, very impressive. And I'm seeing here in my notes SDOH. Can you what does that acronym stand for in the security world?
So that's not really necessarily a security acronym, so to speak. That's social determinants of health. So in a healthcare in the healthcare space. So really,
Gotcha.
what that is looking at the socioeconomic conditions around healthcare as it applies to the members of a community.
Gotcha. Okay. And kind of what are some of the what are some of the challenges that come with addressing those kind of social determinants, and especially in the healthcare ecosystem, and kind of what challenges did your organization kind of experience while working towards equity, and kind of how did you guys kind of mitigate those, if you will? I know that's kind of a convoluted question.
Yeah, no. I think I know what you're getting at.
Yeah.
So long story short, with SDOH, there's not really a hard left and right limit, right? So when you look at this data, what does this actually mean, right? So you kind of need big picture, you need analytics, you need to be able to visualize this data to understand what that means. We kind of looked at it in the sense of we need to wrap a framework around it. And so kind of very early on with with SDOH work, we learned about the vital conditions framework. It's essentially 7 buckets, if you will, that how can I say this? We'll have to redo this part. So early on in the process, we learned about the vital conditions framework, and it's essentially 7 buckets that kind of tell us or give us information or insight into different aspects of social determinants of health. So vital conditions then becomes the model that we look at that data from. That becomes our lens in which we interpret that data. And so, as an accountable community of health, we found that we have a unique opportunity as an accountable community health to help everyone recognize they have a part in creating a system and community that is thriving. And when we look at how intertwined systems and well-being are, we can help demonstrate we all play a critical role in creating a future we all want to live in. And so the vital conditions gave us a perspective, a lens, a framework to look at that data, interpret it, and give us actionable things that we can do to help improve, SDOH within our community.
Gotcha. Sure. Yeah. It's such a I feel like SDOH it's such a aspect that I don't think it's a lot of people touch on. A lot of people look at that. A lot of people really understand kind of what goes all into that, and how that it does affect a community and kind of a whole group of people. Kind of switching roles into the data security of SDOHs. With Elevate Health, I know you guys do focus on addressing those social determinants. How do you think the secure data sharing and integration enables better collaboration between the providers, the community, and other stakeholders within the healthcare system?
Yeah. So one of the many problems we have in the healthcare space, we'll call it, is integration, right? Very few platforms, very few organizations are actually integrating with each other, right? And this is kind of a barrier for quick and efficient service, right? So when you go to a provider or you go to a hospital or whatever, and you have some sort of underlying condition you're being seen for that you are normally seen for, at another provider, that organization doesn't have your records for that doctor to look over to facilitate healthcare services for you. So how do they get that record, right? Like, so we have a couple different things that we use, right? Faxing, kind of meh, right? You fax your record over, somebody's got to digitize it, throw it in the EMR, and it's inefficient. Secure email, we all know the challenges with that one. And then courier services, right? Okay, well, now you have somebody who's got to go pick up this record, bring it, they got to digitize it. It's worse than faxing. So
it's like a Stone Age.
It is. And I think legislation is a piece that needs to come up with some of that as well. Kind of modernized a little bit, but that's a whole different topic in and of itself. But yeah, so the other ways that for the ones that are integrating, right? You see a lot of HL7, you see a lot of API work with integrations, and API is kind of the go-to right now. But there's challenges in that as well. That has to be monitored and audited, and you need to look at that code periodically and make sure that it's doing what it's supposed to do. And then the mechanism for talking across that API, right? Like, how are you securing that? So we kind of went from one realm to the other, and both have their challenges. I think in a modern digital world, with APIs, we have a lot more challenges, but we also have a lot of tool sets to be able to secure that. Case in point, one of the healthcare organizations I work for, we pass data via HL7 through a VPN tunnel, right? APIs, were a thing at that point, but we just hadn't come up to the times yet with that. So HL7 via a VPN tunnel was kind of our go-to at that point. But yeah, but this also opens up governance issues, right? Like if you're doing real-time data sharing, who owns the data at that point? And I think this is the real big key for integration and why it's not kind of a broad thing in the healthcare space is, who owns that record? And when you do pass the record, what are the conditions around that the other organization can store, use, et cetera, that record. Governance is the big issue, and I think we need legislation around that as well, to help push people to integrate more. Because let's face it, healthcare is critical infrastructure through and through, and if you want to provide timely service for people, right, in their time of need, and you need records, you need data on this. Real-time data sharing, whether you're talking about HIE, CIE, other integrations, these are what's needed in the healthcare space.
Yeah, 100%. And another aspect of that, which is touched on the kind of the legislation piece, and which is it just unfortunately is not there yet, and I think probably soon will be with the way things are kind of going. But there's a lot of great companies out there that are trying to look at it more from the consumer aspect, from the patient aspect side of it, to where they can keep just a nice health record of themselves, where everything is organized into different folders, and everything is, so when they go to a new physician, or say they're diabetic and then they have a cancer scare come, so they have to go over to an oncologist, and they have those records where it's easy. They're not having to have the doctors run around and fax and forward an email, and you're 100% correct of how much of a game changer it is, because I think when you do that, the patient becomes involved in in their own care even more than they are currently, which is, I think, very important to having the patient and the consumer buy in to their healthcare system, and their healthcare in general. So that is a great point you touched on. You're kind of switching topics over to digital health and its impact kind of on the social determinants of health. Digital health is obviously a game changer for kind of addressing these social determinants. We've seen that. What health tools do you think can add value to the underserved populations?
I think it's less the tool as it is big data, right? Like you can throw a ton of tools at data and extract different insights, right? But you need to wrap some analytics and some visualizations around that data. And to be honest, your data is going to kind of determine your tool, right? There's a lot of purpose-built tools. There's a lot of kind of just general tools. And you can even homebrew, your own tools if needed. So I think the tool is kind of less valuable in this space as is, the data and being able to interpret it and
Right.
knowing knowing, what you need to get out of the data, right? So it's understanding the big picture. And, when we talk about kind of going back to the previous point, when we talk about people, owning their records, right? The big thing is people need to feel like their health records are their own and available to them in any manner, whether paper, digital, et cetera. But there's an access issue in the community. So computers, phones, internet, these are critical components of a critical infrastructure system.
Right.
If people have access to it, they can interpret their records, right? They can understand, okay, well, I was given this, prescribed this procedure, I was told was warranted, right? They can understand that themselves. by having their own records. So it gives them agency and freedom, especially freedom of choice to pick the system that works for them, or even pick kind of lower level providers. Ultimately finding the provider of choice that they like and feels that cares for them.
Yeah, that kind of leads directly in kind of a purposeful segue. Do you think fostering that digital health literacy is particularly among the vulnerable populations is kind of important, and kind of making sure that that's at the forefront as well of that they kind of understand how to read and how to kind of view their digital health?
Yeah, I mean, literacy is, don't get me wrong, is a critical component. But what we're seeing in the community is access issues. Not being it, maybe it's
Not having
people,
access to it at all.
yeah, maybe it's people who
Right.
don't have a, maybe it's people who don't have access to a computer. Maybe they live in a rural sector, of their region, and they don't have a public library. They don't have great cell service. Maybe they don't have internet. Maybe you know they just don't have the money to pay for those things, right? So access is really kind of the critical component that we're seeing, not so much on the literacy end. So I think, making strides towards getting people access. Internet is, what was it, a couple of years ago? They came out and said, this is kind of critical infrastructure. ISPs, you need to start rolling this out to more people. Start coming up with more affordable plans, those kinds
Right.
of things. So we're seeing that kind of we're seeing that access issue get smaller and smaller, but it's still a large issue.
Yeah, for sure. I know AI is obviously one of the hot button and the kind of hot topic in the world right now, and it's definitely one of the top emerging technologies that's now impacting healthcare, um, mostly for good at this point, I would say. Um, how can we leverage this to improve care access for those communities? Do you kind of see these innovations, or I'm sorry, do you kind of think these innovations can be made culturally sensitive and inclusive for communities, for all communities?
So I'm kind of an AI evangelist. I kind of embrace the AI overlords, if you will. But AI, particularly generative AI, I don't think has much reason to be in the industry. And so I guess to frame it right, AI can speed up and improve accuracy with scheduling and records and stuff like that.
Processes, right?
Yeah, exactly. It has no place in healthcare delivery, right? Like it should not
Yeah,
be making any sort of decisions. Like, okay, you go to your provider or your system's website, and there's always this like helpful little chat bot sitting in the corner, right? Yeah, hey, how can I help you? Right? You start punching in, oh, I feel like this, right? Like the AI chat bot should not be filling the role of a doctor or a nurse and saying, oh, well, it sounds
100%.
like you're dying. Maybe you should come see us, right? Like that's not,
Yeah,
no, that's not a thing that should be happening. But hey, I have an appointment on such and such date and time. I can't make it. Is there anything available? The AI chatbot,
right.
checks the calendar, the scheduling system, and maybe that allows them to reschedule that appointment. I think that's a great purpose for an AI. It eliminates that human need to be there, and allows that organization to focus more on the healthcare delivery space. But kind of getting into AI and culture, being culturally sensitive or inclusive. Uh, Again, I think there's strides we can make, right? So we can give AI language, to use that is sensitive and inclusive. But the problem is, it's not going to satisfy the underlying need of various communities, right? Because the AI has no basis to determine what language it needs to use to be culturally sensitive or inclusive, unless it's explicitly stated, right? So
It's
unless
told to do
the
so.
yeah, exactly. Unless the
Right.
patient or client says, "Hey, I'm such and such," right? And kind of lays out, their their cultural needs. Uh, the AI is going to have no idea who the other person is. So, you'll probably start to see, the AI trying to, interpret, maybe include, terms or content that is culturally sensitive to the wrong group, et cetera, et cetera. So there's a lot of challenges with that. Um,
Yeah.
and I I I think we're on the path. I don't think we're quite there yet. I would venture to say maybe 5, 10 years down the road,
I can
we
see that
might be
too.
able to start working into that space. But I don't think that's going to be anytime soon.
Yeah. Yeah. And I see more of it in a kind of the digital health literacy aspect of it, of using AI, using some of these machine learning or natural language process, whatever it might be, to kind of help the patient understand their diagnosis better. So when they do go home and they're looking kind of at when they give you that sheet of paper with your diagnosis on it, and it tells you kind of what it is and to follow these steps. And I could see it also being a tool in that aspect, to be like, okay, well, let me help me understand what this is going to be, whether that, like, the changes after you become type 1 diabetic, or diabetic. Well, okay, well, not only are you going to be making these medication changes and these lifestyle changes, but also these changes to your health, your diet, your exercise, and all these things are necessary to have um, good control over any kind of illness, in my opinion. So I think I see it also being a tool in helping some of those populations that are underserved, in the kind of literacy of understanding, kind of when they leave a doctor's office or before they go to a doctor's office,
Yeah,
where it's not necessarily. But I agree with you where it needs to be a kind of a fine line, where you never, I don't think you ever want that replacing the job of a nurse or someone that's diagnosing, that I put X, Y, and Z into a chatbot and it's telling me I've got this,
yeah.
is definitely dangerous. But the other aspect of it, of helping me kind of understand something that's been told to me by my physician, is a whole other point, which I think is a tool that is super exciting, as well. Kind of a whole other aspect to kind of what you were talking about as well.
Yeah. Well, I mean, the other side of that is, you kind of touched on MLAI, machine learning AI,
Mhm.
right? If you were to bring this into your EMR system, right?
Mhm.
And maybe you have a radiologist who's looking at, a bunch of images, MLAI can kick in and say, "Hey, wait a minute, I'm seeing this thing over here," right? Maybe it's something that the provider wouldn't have noticed, because MLAI is just crunching images, hundreds of thousands, if not millions of images,
Yeah.
for, maybe this, maybe a heart, maybe a lung, whatever. And so it's trained a lot faster than the uh, than the radiologist or the physician has on, looking at these images. I don't think it's a replacement by any means for
Yeah.
this, but maybe that will help, you know, uh, find something that
Would have
maybe
been
wouldn't have
missed.
spotted. Yeah, that may
Yeah.
have been missed. I think that's a good application for ML AI. I think generative AI, and when we're talking about uh, sensitivity and inclusion, or just generative AI in the healthcare space at all, it is really kind of a route, kind of a road that we shouldn't be going down right now.
Yeah.
Um,
I agree.
yeah, yeah,
Yeah, because I
different.
agree with you where it's just the technology just isn't. I don't think it's there yet. I'm not saying that maybe in the future that it's not something that they could be. But like, I think currently it's just it's just not there yet. I think people want it to be, because it's the new shiny it's the new shiny car, the new shiny toy, but you can definitely, I think if you're in this space and you're in this world and you kind of see it, and you understand it, you see where it lacks still, and you see where there can be big challenges that it faces whenever you're dealing with, when it's making decisions that affect actual people's health. You're not worried about processes and efficiency. So those are really great points, Aaron, that you brought up, and I really appreciate it. It was a real pleasure. That's kind of all the questions I had for you today. It was a pleasure talking to you, Aaron. Thank you for joining us, um, sharing your insights on health disparities, on data security, care delivery, community care, digital health, kind of everything that we touched on is it's what's wonderful, and a whole. I love doing these because I learn so much myself. I mean, I'm in the digital health space and I've been in for a while, but I learn something every day whenever I do these podcasts. So really appreciate your insight and your time today, Aaron. Thank you so much.
Yeah, you're welcome. Again, thanks for having me on. It's been a pleasure.
Yes, sir. Well, I look forward to staying in touch with Elevate Health and seeing what you guys do next.
Yeah, certainly.